everyone. So yeah, today we're going to have a presentation. It's probably going to be about 15 minutes. And then I have my dog who I can show you sort of the positions, and I've got the machine set up with a different camera so you can see what settings I will use when I'm treating the hip using the MLS laser. We've got a few studies, so if you've got questions about those, I'm happy to answer those as we go along when we sort of get to the practical part of the presentation. So I'll just do, it will be a brief summary of what MLS laser therapy is and what it does, how it fits into multimodal management, which is obviously the buzzword at the moment of managing osteoarthritis. The evidence of benefit specifically in dogs, obviously there's lots of work that's gone on in humans and in other animal models in terms of the benefit of laser of wound healing and in treating osteoarthritis, but specifically there's a couple of studies that have been done in dogs recently. I'll briefly touch on pain scoring and how that might be something that would be useful to fit into practice. We'll run through myofascial trigger points again, as we have done when we've talked about elbow osteoarthritis. And then I'll go through protocols for acute disease and chronic disease with, hopefully, if the dog's behaving, a practical demo as well. So you would have seen this when you got your MLS laser in practice. It has been patented to be a pulsed system. So you've got two different wavelengths there. We'll go into a bit later, more detail about that later on. So it's also known as photobiomodulation or low-level or high-level light therapy. So it does actually provide both low-level at the 808 wavelength and high-level laser in dogs at the two different wavelengths, which the 905 nanometer wavelength is pulsed all the time. So you can see it's pulsed here very quickly, and then you've got either the option to have the other wavelength 808 continuous or pulsed. So on the settings it will automatically give you a pulse treatment usually. Sometimes but there is options to increase that amount of laser that you're getting into an area, particularly if you've got really chronic with a lot of bony change in the hip area. So photobiomodulation, I've obviously got a typo there, I'll change that. It's a painless, non-invasive, non-toxic, it's easily deliverable in practice, it speeds up healing, provides analgesia, reduces inflammation, and there's no side effects as such if you're using it properly. Obviously we need to ensure eye protection for both ourselves who are delivering the laser and for the dogs, ideally with these goggles that you've got or with a towel over the eyes as well is appropriate. So photostimulation of the cytochrome C within the mitochondria, that leads to the mechanisms of action. So it increases nitric oxide, leading to angiogenesis and vasodilation. It interacts with the cytochrome C oxidase, which increases ATP within the cells, and that is what the cell uses for cell repair. So it stimulates fibroblasts as well. It increases reactive oxygen species, and that's thought to start the endogenous antioxidant pathways. You've got reduction of inflammatory cytokines, so particularly in osteoarthritis, this is important, as well as reduced COX-2 mRNA expression, so using the same pathway as non-steroidals. So in practice, all too often, we'll see dogs very late on in the course of the disease. They might have already started a rehab program. They might have already gone for hydrotherapy or physio. They might be on a weight loss program, or at least should be, if they are significantly overweight, or even just to get to the ideal body condition. They might well have started supplements, they might have ramps and things to help them get into the car. All too often the vet recognises that obviously pain, sometimes it's not recognised so much with the owner, but pain is recognised. They might start some non-steroidals, then adding in further opioids, MDMA antagonists as well, gabapentin. And this is often where vets concentrate. But I would argue that actually starting earlier on in the course of the disease, so trying to help maintain the joint mobility, preventing the reduction of muscle strength, and certainly this is where laser can be really helpful, because often you get muscle fatigue, and the MLS laser can really help with this, so that they don't either, if they're already on these, you can sometimes reduce the amount of medication that they're on, or hopefully prevent that happening until much later on in life. It provides an opportunity for both patient and owner combined approach, because the owner will be helping, they'll feel more engaged when we're doing pain scoring and updating the vet and the nurse. Often we'll have, hopefully, full diagnostic info with either scans or x-rays. It tends to be, you know, once they're on a regular program, it can be easily done within a 10-minute appointment in practice. They can come once a month, or even longer than that sometimes, for treatment. And you can then sometimes pick up any issues before they become a problem, certainly if you're doing regular pain scoring, things like that. Tends to lead to increased patient interaction with the practice, so that you can build and strengthen your client loyalty. Obviously can help with practice revenue as well, all important in these tricky times, and most importantly, improved outcome for the patient. So the studies, I did touch on this one before. We talked, it was a randomized blind placebo trial where they investigated photobiomodulation on 20 dogs with naturally occurring canine elbow arthritis. So what happened was, they were already on, a lot of them on non-steroidals. They had photobiomodulation at between 10 and 20 joules per centimetre squared, twice a week initially, and then reducing to once a week for the last 3 weeks of the study. In the group that had the laser, so some had sham treatment, in that group that had the laser, 82% of them could reduce the dose of the non-steroidal vet they were on, compared to none of the group that didn't have laser. There was also an improvement in the lameness score and a reduction in the Helsinki Pain Index. So there's another study here that, rather than comparing does laser work, does not, how does it work, it was comparing, rather than adding in laser to that treatment, it compared the outcome of dogs with osteoarthritis with non-steroidals, and comparing that effect to laser. So they recruited, there was, I think they looked at sort of 30 odd dogs, but 16 of them, they were all Labradors. They had naturally occurring osteoarthritis, not always in the hip, but in different joints there. So they split them into two groups. Group A had laser, and this was with the MLS laser, 4 joules per centimetre squared. Initially, it was 3 times a week for 2 weeks. Then it was twice a week for 2 weeks, and then once a week for the final 2 weeks. At each of these sessions, before they had laser, they had hydrotherapy for 3 minutes, and that was 4 times, and that was to warm the dog up. So it wasn't a blinded study. People knew what they were having, obviously. Ideally, I guess the hydrotherapy should have been used in the Group B dogs as well, so you could actually compare the laser to the non-steroidal effect, but that wasn't done, unfortunately. The other group had Rimadyl, carprofen, initially at that high dose, 4 mg per kg once a day for 7 days, and then 2 mg per kg, we put grams there, once a day for 7 days. Then they were assessed. One of them was done by the owner, so the Liverpool Osteoarthritis in Dogs scale, so the load scale, at day 0, day 15, and day 45. So obviously this was testing immediately at the maximum effect of the Rimadyl, and then afterwards, later on when that Rimadyl had worn off. And then it was also done by a technical expert, so a veterinary nurse who was trained in assessing the canine brief pain inventory index. dogs. So the degree of lameness in both groups decreased, and there was no significant difference between these two groups. So it shows that laser is as effective as non-steroidals in these groups of dogs. Obviously, you know, it may well be that you could argue, well, what about if you keep them on the Rimadyl? Is that going to have an even greater effect? But I would argue if you're using a treatment that actually doesn't have any side effects, certainly in dogs, there's a number of dogs who can't have the Rimadyl or Metacam regularly, then it's certainly something to consider in all dogs, if not even those ones that are highly sensitive to non-steroidals. Significantly in Group A, there was actually an improvement in the, there was a persistent decrease in the pain associated with flexion and extension of the joints, and the reduction of the trigger points. So particularly in those dogs that just have laser, this wasn't found in Group B. So just to briefly summarise about the pain scoring, these are the two that are used commonly in practice. So there's some articles there. You can just look this up online, and then there's you can ask the owner to complete this online and then bring that with them to the appointment before they even come into the clinic. The Liverpool score, the load scale, tends to focus more on animal mobility, and the canine brief pain inventory done by the University of Pennsylvania tends to focus more on the pain aspect, which, as we know, is always difficult to identify. A lot of, oh yeah, he's limping, but he's not in pain, a lot of the owners will say. But obviously, as we know, it can be, if you've got an actual score there, it can be useful, certainly before and after treatment, but also to see how they are 6 months, 12 months down the line as well. They can both be used together. Both the owners can actually complete these themselves. Obviously, there is a degree of subjectiveness there as well, but they are as good as we've got, really, rather than just saying, yeah, he's a bit better than he was. You know, videos, again, are another useful way of looking at the before and after.
Sorry. Is there any other way of doing it? Would owners look at it subjectively with, you know, what they managed to do with jumping in and out of cars and all the rest of it, or jumping on the beds and that? Would you use that?
Yeah, I've actually, recently when I treated a dog around the house, they weren't particularly that different, but what they did notice was the interaction that they had with other dogs in the park. Yeah. They weren't as shy and they weren't as tentative. And they were happier to play. Often you'll get, oh, they're playing like a puppy again, or they're just freer. And so they tend to be, when that chronic pain isn't there, it's not until it's gone that they realise that, oh, they must have been a bit, and sometimes it's the same when you do a Metacam trial, that's what you tend to find, particularly if they've got muscle pain. Very often, even after the first laser treatment, they'll be a lot more comfortable, because it's the muscle pain that's a lot less easy to identify sometimes on clinical exam as well.
Yeah, it's good.
So yeah, in summary, benefits of laser in terms of what you can expect, you tend to, obviously, you know, there will be a degree of, you know, accumulation of benefits when you're doing repeated laser treatment, and obviously it's better for the bottom line in the practice. But if an owner can come in once a week for 3 or 4 weeks, I would not be worried at all about starting them on a course of laser, because I think it would still have significant benefit for them. Reducing pain, reducing inflammation, reducing swelling edema. Obviously this is specifically post-operatively, tends to be really effective at trigger points, increasing joint mobility, and then obviously, as we've seen, tapering up the meds as well, as and when we can. So just to run through what trigger points are, they can appear in any muscle. I've got a bit of a sore bit going on in my shoulders still going on. They are hyper-irritable spots within the muscle, and you can either identify them by palpating over them and they feel like a sort of solid nodule. You sometimes get then a reaction to this. So the dog will turn around in pain or howl or be particularly painful with it. Once they're treated with the laser, they tend to be not painful anymore. And so during the course of your exam and your treatment with laser, you can go back, you can treat the trigger point and then go back to it and see if it's not painful anymore, and treat again up to 3 times if you need to at each laser session. So I'll just move the box there so you can see these slides. It tends to be because of overuse and overload of the muscle. You get excessive release of acetylcholine at the end plate, the sarcomere, and muscle injury as well can reduce these toxic substances. You get decreased ATP within the cell, and you get sustained contractions at these areas. It's thought to be as well related to the calcium pump, which is ATP dependent, with increased calcium concentration, and so the contractile activity remains high. You also get inhibition of the reciprocal muscle sometimes, so the reciprocal muscle in the same leg, so you can get a just general weakness of the whole limb. Usually caused by yeah, any questions there?
Yeah, just, do you find them, they decrease once you start using the laser? You know, in treatments 2, 3, 4, 5 and 6, would you see less trigger points? And
you would, yeah. I tend to treat the trigger points the first 2 or 3 times.
Yeah.
And then after that, I might well use like a muscle contraction setting.
Yeah.
Just to sort of relax the muscles and because I think it does help with pain relief. So it depends really on the dog and on what the issues are. Often, sometimes you can treat forelimb lameness and then you find that they're actually painful in the hind limbs the next time you see them.
Yeah.
Or vice versa. And because obviously, you know, everything is linked to the spine. So often, if there's mechanical stresses going on in the back leg, you'll get then this kyphosis going on over the back. And then there's also the forelimbs are working harder than they should do. And so sometimes you just have to examine the whole dog to see where the pain is coming from.
Yeah, excellent. Thank you.
They have found in human studies there's other nutritional factors as well. Obviously, these aren't confirmed in dogs, but you know, certainly with hypothyroidism being so common in dogs, it is worth thinking about some of the cramps, some of the weakness, some of the myalgia may not just be because of the chronic muscle overload. There may be other systemic factors going on as well. So this is what tends to happen. You get a cranial weight shift, overuse of the muscles of the coxofemoral joint. You leads to a cranial weight shift and lateral flexion of the spine if it's unilateral. And it's the paralumbar muscles that tend to then help to bring the pelvic limb forward because the dog is resisting flexion of the hind limb. So this overloads these paralumbar muscles and the forelimbs. And yeah, the stifle extensors, you can sometimes feel that they're sort of contracted to prevent flexion of the limb. So just by sort of, obviously another thing to do would be passive flexion and extension, and that can help with this sort of muscle tension that you're getting. Obviously you can see it by, you know, often, you know, you'll have diagnosed arthritis somewhere or pain going on in the back leg just because of the way the dog walks into the office, or these days how it jumps out the car. We can see it up for ourselves, how it's moving. Now we're all seeing them in the car park, getting out of the car. So these are the common areas in the dog where you tend to get them, and it's just a case of palpating where they are really, and seeing, particularly on here, you tend to get this arching. Is it abdominal pain? Is it pain of the back, or is it pain coming from someone else? And this is just muscle pain that's going on. Obviously you can get in the quads as well. We can label them all so we don't have to remember what they all are from my year 1 anatomy. There we are, semimembranosis, semitendinosis, everyone remembers those. So how are they treated? So with the laser, you can just have it on trigger point setting and directly treat over these trigger points. It's the setting for about 20 seconds. It helps to reduce tissue hypoxia, reduces edema, particularly increasing the microcirculation and oxygen of tissues. So particularly in these trigger points, that's how it helps. Enhance collagen production as well, decreasing inflammatory mediators. So moving on then to practical treatment of the hip. You can see on here that there is an arthrosis setting. So when I started off, I just got ticked on the arthrosis setting, set it to right hip, right, and point mode, right, 6 points over the hip, and that's all I did. And I still have good results. But if you're trying to do maybe a little bit more of a fuller exam of the patient and trying to help with the sort of muscle pains, what I would suggest you do is treating any trigger points, and you can treat those up to 3 times. And this is on both sides, because it might not just be the side that's affected. Often when it's hip disease, because it tends to be bilateral, the signs that you sometimes see on the x-ray, they're not always significant with the actual amount of pain that you're getting within the dog. I'll tend to treat both hips, left and right, but by your exam, you'll know which one is more painful by the way the dog's moving. So I'll treat the trigger points, I'll treat any muscle contracture over the back of the dog, often in scan mode, sometimes in point mode, and I'll still move the probe a little bit because the point mode tends to be a little bit quicker. And then I'll treat directly over the joint with both chronic pain and chronic inflammation setting. And you tend to get up to about 8 joules per centimetre squared. So it's still, you're still very much lower down. I mean, you might be able to help me, John, what the maximum amounts that they're using in humans at the moment. But it's way lower in dogs, and I haven't had any refractory issues with using too much laser with the MLS because it's very controlled.
Yeah, we see the settings are very similar when we look at them. It's, you know, the way we react, unless we're dealing with an equine patient, there seems to be the settings between a companion animal and a human are very similar indeed. So.
Yeah. Because obviously with on the equine side, we're going to be using, you've got, you know, the laser head, but it's actually 3 together. So you're treating a muscle, but it's obviously 3 times the amount of laser that you're delivering to the muscle, because obviously you've got a much larger muscular area as well.
Yeah, interesting side point on the trigger points with the equine is they designed the handpiece, which we've got, the small one you've got there, Caroline, precisely to treat equine trigger points, because it'll be a slightly bigger trigger point than in a dog or a human.
Yeah.
So that was the theory of why the handpiece is that size.
Yeah.
Yeah.
So locations wise, you'll tend to go over the hip in 6 points. So directly over the hip, and then I tend to use in a sort of daisy pattern. So I'll start in the middle and then move my way around so that I'm treating the muscles associated with the joint of the hip. Sometimes if there's a lot of pain, I have a feel on the inside of the muscle as well. And so I might well try and treat, depending on how big the dog is and how amenable they are, I might actually treat on the inside of the hip as well, to try, and particularly if there's tension on the inside of the hip as you're going up into the groin, and I've found that to be quite useful as well. So you can see here, you've got the options here. Acute pain, it will already set your frequency for the second, the other one is already pulse 905, and then the 808 is the frequency is set here. You can see this is in scan mode, so you can see it gives you about 6 minutes 20. So you could, if you preferred, just have the laser head over the joint itself and just move it around if you prefer to do that. But if you're on, you'll tend to actually get a very similar figure if you go onto point mode, and that will be more like 2.5 minutes. So if you're treating both hips plus I tend to use point mode just because it's that much quicker to do it. So with the acute protocol, you tend to want to treat the dog at least twice a week. If you can, you know, depending on when they come in. If it's Tuesday, I'd probably treat them Tuesday and Friday. If it's Monday, I might well say Monday, Wednesday, Friday, and do that for 2 weeks. And then once they're a little bit more comfortable, a bit more stable, I'd say once a week, and then to go on to maintenance program after about a month. Obviously, it's quite useful then if you're seeing them every 2 to 3 weeks to combine that with your weight loss program or gradually increasing exercises. I've heard of people, rather than saying, oh, just increase your walk, because obviously exercise in a controlled manner is useful, for some people to actually increase, say, do 1 or 2 physio walks a week. So they'll include a bit of a hill and go up and down a hill with the dog, rather than just, and that is sometimes easier to add in rather than saying, oh, they need to do more exercise and lose weight. People can find that they find the time to do that 1 or 2 extra walks a week, whereas it's a little bit overwhelming just to, oh, increase the exercise. That can be quite helpful. Hydrophysio has its place. I don't always add that in to some of these older dogs because it can be exacerbate pre-existing conditions if they're just generally, then it's really good at increasing the muscle, but it really depends where they are really. And certainly I'd say if you are, a treadmill hydrotherapy is sometimes a lot better to increase the amount of muscle if you're looking to improve that for walking, rather than just improving swimming muscles, particularly if there's a lot of issue with a large amount of movement of the hip. And then tapering medications as well, obviously. I just wanted to say there. Yeah, if there are implants there, then you can still use the laser, but you just need to make sure that you're lowering the intensity. So I'd go to about 50%. And ideally, it's just because the soft tissue overlying those implants would receive an increased dose of the laser. So they need less laser than more. So in terms of maintenance treatment for arthritis, then I would rather, usually there aren't any trigger points, but if there are, you can treat those. But I'd still use a muscle contracture setting on scan mode over the back of, because you still tend to get pain going on in the muscles of the paralumbar muscles. And then arthrosis setting, 6 points over each hip, as we did before. So how often would we do this? We would tend to do this. You can also, move the joint back and forth, if you can, you often need an extra pair of hands. So sometimes I'll just treat the dog on my own if I know it well. You do, if you are going to be lifting the leg and extending and moving the hip joint around, then often you do need an extra pair of hands as well. It tends to be weekly, fortnightly, monthly once they're stable is usually sufficient. I've often gone for much longer than that and just started again, maybe 2 or 3 weekly treatments every 2 weeks if they need a little bit of a boost, if they've had a fall or something like that. So this is when we were using 2 lasers at the same time for an old guy at one of the demos we were doing. Because he had bilateral elbow arthritis, so he was tolerating it very well. So if you can see on the screen there, you can stroll down and there is a setting there for trigger points. And yeah, 25 seconds. If I'll just get my glasses on. So you can see with that. So once you start that off, that's just ready to go and it will count down. And with the trigger point, because often you're treating at the back of leg, or you'll have a feel down wherever you're treating. You just
Palpate.
have a feel around the back here, whether this is his tail here, just because it just looks like his head's up here. So you have a feel down the back here, and then around the back of the leg. That feel, there, sort of inside. This side, you just have a feel of all these muscles here, and if there is a trigger point just here. So you can see I set that off going on the machine, and I don't have to reset anything. I can just get my probe ready again, and then, so just in this area, you can then, if I found a trigger point there, you could just press that again, and then that will just deliver laser in that area for 25 seconds, and then you can just either, sometimes I'll just massage that over there, and then if you did need to stop, you can just have a feel of it to see if it's still there, and then give it a little bit longer if it is, and then you can treat each trigger point for up to 3 times each time, and go back to it at the end. So let's just do so then over the hip, you know, you might well just have a feel back here when you're examining them, sort of having a feel at the head of the hip here. And then when you're treating the hip itself, you'll just hover that over that area, and then sort of go round in 5 places around the hip, just like that. And then if there is pain inside, it's a little bit more awkward to show you on the inside, but you can also do that on the inside if you needed to. So I'll go back here. So we'll have chronic pain setting, 6 points. It's about 4 joules per centimetre squared. And then, as normal, you'll just set it to start, and pressing the button on the laser head, and you can see it just counts down and then tells you, once you've treated one spot, when you need to move to the next spot. Next point. If you want, you can then, sometimes I'll do it before, you can treat on muscle contracture setting. You can see the frequency changes quite a bit, because this tends to be a better frequency for muscle contracture. You're still delivering about 4 joules per centimetre squared. So when you're treating with chronic inflammation, chronic pain, it's always set at about 4 joules per centimetre squared. You can find if you did feel that with it, for some reason you weren't quite getting the results that you wanted, you can, and there's more inflammation, you can change that to continuous, and you can see it does increase significantly in the amount of laser that you're delivering. But you don't often need to do that. And then on the arthritis setting, you'll see that it will give you about, it's about 2.5 minutes. And that tends to give you a good amount of laser for what you need when you need it. So yeah, don't forget, when you are treating hip, just have a feel in the muscles around the front of the body as well. So these tends to be the area in the lumbar spine where you tend to get the problem, but you can also get pain going on in these muscles here that have been sort of taking a lot more of the weight, and sort of working harder in the forelimb if they're having to take more of the weight of the hind limb.
Caroline?
Yeah?
We have some questions. First one is on the reducing pain in 2 visits. Is this based on, is it just a laser, or is this using the drugs or any other physio side, or any other factors?
That tends to be just with the laser. That's what we found in some of the studies that we looked at there, that they show that there is a reduction in the pain within 2 visits. Obviously, you get more of a difference as it goes through, and it's always difficult for me to say, and oh, you only need to treat twice and that will sort out the pain, because often, you know, it is a chronic condition, so you haven't got rid of the originating issue. So it's not like that will treat the pain and then, okay, they don't need treatment for another 6 months. Because it's a physical issue, you know, you do tend to need to repeat the visits. But part of it, a lot of the time, I think people are reluctant to start a dog having laser because they think, oh, well, I can't treat the dog every week. So, but I've used it more for painful conditions, for like skin disease and things and hot spots. Just treated it, just give them one treatment, and they tend to be a lot more comfortable afterwards. Yeah. So not so much with arthritis, because you tend to want to have a program that you're going to be able to deliver over the next, you know, for the lifetime of the dog, for the next sort of, you know, 2 years. So.
And does the study show a reduction in the number of trigger points, or in the actual
the number of
trigger points?
Yeah.
So we'll actually see a reduction in number. Okay. Can we get a hold of a copy of the study so I can share that?
Yep.
If you can send that, I'll pass that out to anyone who wants a copy of that. And the other question was,
it's actually, it's on the Energy for Health website, BSA website. The most recent one that was just published this year.
Yeah. Okay. Perfect. And the other one was with people coming through the physio-based training. When you train at college, they give you different dual settings. This is just manufacturer research, isn't it? Which this is based on.
Yeah. That's right.
Excuse me. My understanding of that is because of the way the output comes from the ACES system of the combined and synchronized wavelengths being emitted at the same time.
Yeah.
And the fact that we're not generating heat, we do have a different level of joules, but that's basically one research versus another research.
Yeah. It's one of those classic sort of difficulties with laser, because each laser has a different amount. Oh, so what is the amount of laser that you need to give, and what has been studied or not studied, or how much laser is delivered? You know, I've got the laser therapy manual from Godbold is a good place to start in terms of, you know, and even then it's their experience, you know, and they've actually pulled together a huge amount of research as well in there. So there's a lot of research from the human and the rodent model and animal model side, the sort of science behind it. But unfortunately, with the protocols, a lot of it is user experience, and this is what they would recommend after, you know, 10 years of experience in using laser within the veterinary field. And even that isn't necessarily published. So yes, sometimes they're going up to levels of sort of 20 or 30 joules per centimetre squared. So, you know, and that they found that particularly for these chronic conditions can be really useful. But it's, I would say, use your machine as the settings are prescribed and as we advise you to. And there's people who've had their laser for a couple of years in practice. We have produced a new brochure on protocols in the last 6 months or so. So that might be something to sort of get hold of as well, which is again sort of just a good summary of what settings to use if you're sort of moving beyond the sort of standard inflammation for everything, chronic inflammation, acute inflammation. I'll just use that. There's a little bit more on there about do I use pain, do I use inflammation? They have to come hand in hand.
Yeah.
And it'll really be the frequency of the second pulse that changes and that's the difference. So they found that different frequencies of the laser will give slightly different results on different cell lines. So that's the difference in why they have created the protocols that they have.
I guess going back on the trigger points, is my understanding from what I've seen and what I've done is if we manage the patient's pain, reduce the amount of pain that they're in, they then move and hold themselves in a more normal way of doing so.
Yeah.
And therefore we see a reduction, ongoing reduction in trigger points because they're not compensating for that amount of pain which they're walking and moving in.
Yeah.
They're not loading muscles in an unusual way. I don't know. I mean, that's my subjective gut feeling, really.
I think that is, and often it can take time to get to that point, because if they've been holding their limb abnormally or using it abnormally, the muscles aren't working in a normal way either. So it can take weeks, and combining that with the physio and the passive flexion and extension exercises can help as well. So it's all part of trying to get them back to sort of normality, or as good as, you know, as normal ambulation, really, as normal as they can be.
Absolutely. Excellent.